Good morning, group. Tony Maritato here. In this video, I want to talk about the lateral knee pain, the pain on the outside of the knee, just a little bit below. I shared a video not too long ago. I'll try to link it up here in the card, but let's talk about that lateral knee pain, and let's talk specifically about the fibular head, the fibula bone. Behind me, kind of over to the side, where is it? There it is. You see some x-ray images of various knee replacements. Now this is just a Google search. And what you're gonna see, let me pull in, let's look at this one. So I'm gonna zoom in on this particular image. Sorry I didn't have this ready for you guys. But a couple of things for you to think about. So like I mentioned before, when we're looking at the knee kind of head on, what you see here is the top bone is the femur. The bottom bone with the implant is the tibia. You see this little shaft that goes down into the tibia. You see these diagonals. Now, a lot of patients will come in talking about kind of this shin bone pain or pain right below the joint line, kind of on the front sides, anywhere in these sections here on the tibia. And I'm not the surgeon. Absolutely, that's a question for the surgeon. But I will say that some amount of logic in my head suggests that these implants create pressure on the bone in ways that are different than the original knee you were born with. And so I have to think, especially if there was any kind of curvature to the knee, when they go in and they straighten out the leg, that now that implant is kind of pressing on the sides, front, lower sides of the knee. I think that kind of bone pain, that shin splint pain that people always talk about, to me that's consistent with that kind of stress. So it's definitely something I would ask your surgeon about, but it's something to consider. Now let's talk about the pain on the side of the knee, out there where that fibular head is. There are nerves that run around the fibular head and go down the side of the knee, but you can see from this graphic, the tibial implant sits up here. Nothing technically was done to the fibula during the knee replacement, but the fibula has cartilage on top of it, just like your knee did. Your knee no longer has it because the replacement has replaced that. But it's reasonable that some of that cartilage, if you look here, the image on the right, let me move my graphic over. I'm gonna go up here. If you look at that image on the right, you can see that fibula coming up along the outside edge of the knee. It's reasonable that it could get irritated. So if you had cartilage in the knee joint that was irritated, the fibula cartilage could also be irritated, could also be inflamed. Absolutely a component, a contributing factor that may be adding to your pain. What I would suggest is when you go back in for your next follow-up with the surgeon, they're going to do imaging, they're going to look at it, they're going to say, hey, Tony, everything looks great for the knee. The implant's in place, everything is solid, awesome. Doctor, can you tell me, is it possible that the pain I'm experiencing on the outside of my knee is associated with the top of the fibular bone? Or the pain, like in this case, not every time do they cap the bottom of the kneecap. Is it possible that the pain I'm experiencing is coming from the bottom surface of the kneecap? There's other factors. Now, I'm not saying it's never going to get better. Absolutely keep doing what you're doing. Keep working with your physical therapist. Listen to your surgeon. My goal in this video is just to bring some different perspectives and maybe introduce some new questions that you could be asking. So guys, keep the questions coming. The group has just exploded. If you're not in the Facebook group, it's free to anybody. Total Knee Replacement Support Group 2020. We have a lot of physical therapists in there who contribute and help support the group totally for free. They're amazing. I can't thank them enough. And then we have a whole bunch of individuals who are going through the process right now, or have been through the process. And they are phenomenal at helping, provide support and answer questions. Guys, as always, like this video, subscribe to the channel if you haven't, and post your questions on YouTube in the comments so I have more content ideas to create more amazing videos for you. I'll catch you in the next one.